Good afternoon. And today we have an honor of interviewing Roger Price. Roger Price is such a multi-talented Renaissance man, and he significantly impacted my life and my interest in sleep and breathing disorders, or how he called it, breathing disorders that affect sleep. So good afternoon, Roger. And he joined us from Australia.
Well, good afternoon, Maria, and it's morning here. It's Thursday morning at 9 o'clock. So certainly very happy to be with you. And it was so nice seeing you a couple of months ago when I was in the US.
Yes, it was very nice. So I'm gonna first say thank you very much to our audience. If you someone who have trouble sleeping or sleep next to the snoring partner, our program is for you, and especially if you're suffering from asthma. If you're a medical professional, uh, please use my channel as a networking ground, because only together we can put pieces of that multifactorial disease and find a solution to improve life of our patients. And most of all, I would like to use our channel to build a community of people who are passionate about sleep and breathing and overall health. Let me tell you first about our meeting, or my, line of events, what keep us together with Roger. Uh, First of all, Roger, live on a different continents. He started his career in a university in South Africa, where he studied to become a pharmacist, and he has honor degrees in physiology and pharmacology, so he really knows the root of the problems. And then he got education as a clinical nutritionist. He looked on the problem from a lot of different points of view. We're gonna find out his views today. And then he started his challenging way to find the cause or remedies for sleep disorders, so sleep and breathing disorders, and introduce his concept in airway management for, in the world of dentistry. I personally met Roger in Dr. Raphael office, where he, helped people breathe. And Dr. Raphael, we interview on our channel as well. He's also really distinguished scientist in this area. And Roger showed me what actually it means to breathe right, or to breathe healthy. So my first question to you, Roger, please tell me how, this whole trajectory of your adventures in this world happened, and what made you so passionate about world of breathing, sleep accordingly.
Well, the answer to that, Maria, is quite simple. When you see something is not working, you either accept it and you go along with it, or you change it. There are only two things to do. So when I was very young, as a young pharmacist, and I saw prescriptions coming with 6 repeats, I had to stop and say, well, if the first one didn't work, why would you give 6 repeats of something that isn't working? And that's what actually started my journey of questioning gold standards, best practice. These are things, these are constructs which are very convenient, and most of them are commercially based. Best practice is what most people do. It doesn't mean it's the best way of doing it. The gold standard is just, that's the thing that more people bought, so that's the gold standard. So I have an inquiring mind, I've always had since I was a child, and I decided I would investigate the why. Everybody is talking about the how. So remember, I started my studies back in 1955. That's probably before most of your viewers were born. And in those days, health was a calling. It was a profession. It wasn't a business. And we focused on trying to get people to make themselves healthy rather than to accept that they have a disease and how do we best manage that disease. That was my background. And that is why today at age 83, nearly 84, I'm running around the world saying to people, if we can find out early what the small problems are, and we can address them early, we can prevent them from becoming big problems later on. So that took me through body of work, through remedial and clinical massage, took me into behavioral modification, into what makes human beings create habits and why they create habits and how we can help them to see the habit isn't working well for them and how they can change it, not how I can change it for them. They must make the change. And that, of course, led me to the concept that everything is based around one thing only, and that is survival. And if either one of us fail to take the next breath, that's the end of this interview.
You're right.
Consequently, every living human being, whether they're aware of it or not, their 100% focus of their organism is on taking the next breath. And the body will make sure it does whatever it has to do to allow that breath to happen, otherwise you're dead. That is the root cause of all of these problems. And people develop different strategies at different stages in life so that they can take the next breath and continue to survive. That is my journey. And I will be on that journey until I take my last breath, which is going to happen. None of us are going to live forever.
On that, a little bit sad note, I want to mention what this month we're doing several programs devoted to our mutual friend and a mentor for me, Dr. Ted Belfor, who unfortunately so suddenly passed away and keep us devastated. And I would like, in his memory, I would like to ask you how, I know you've been connected and, partnering with Dr. Belfor. What was the idea, what you find in common with Ted? Or basically how dental health affect sleep quality or overall being or vice versa. I would like you to talk about epigenetic and functional matrix theory, what you're both so passionate about.
Ted and I were friends for more than 20 years, and I was very sad when he left us. And we both agree that the most famous anatomist in the history of the world was the man who wrote the song, "The foot bone is connected to the ankle bone is connected to the shin bone." The human body is not a series of silos. It's not a series of boxes. The human body is a totally integrated whole of 11 functioning systems. And if you mess with one system, you're going to get consequences in those other systems. So with any dedicated profession, like medicine or its specialties, 138 specialties in medicine alone, in dentistry with its 7 or 8 different ists, your endodontist and your prosthodontist, etc. The focus tends to be on a specific part to the exclusion of the other parts. And it was 25, maybe 28 years ago that Ted recognized that he was looking at the consequence. He wasn't looking at the problem. The problem happened way before the consequence. The problem for that poor occlusion, that problem for the very small maxilla with a very high vault, it's not genetic. Okay, in some cases, there is a genetic proclivity towards certain facial shapes. But generally speaking, if you have a look at your history going back, look at your skulls of 300, 400 years ago, you don't see malocclusion. You see these big, wide arches with room for all 32 teeth. So Ted started to go into the epigenetic causes, the things which got in the way of the genetic potential of the human being not being achieved because of interference. But that genetic potential still exists. The potential for the maxilla to grow to its full genetic size is still there, even though it hasn't been fully exploited. So that's where we had a lot of interest. And of course, that brought in my passion with posture, because it is posture of the head, of the neck, of the shoulders, of the back, of the legs, of the feet. It is this posture which controls the way people breathe. And of course, then comes the survival, where it's much easier to breathe from your upper chest and your mouth than it is from your nose and your diaphragm. So all of these things came together to say, well, the teeth are crooked because the jaw didn't grow properly, because something interfered with that, and that caused the postural change because the person couldn't breathe, so they changed their posture so they could breathe more easily. And so this whole concept, it's not new. In fact, it's very old. This is what Dr. John Mew has been talking about, and he's well into his 90s now. He's been talking about posture right from day one. So this is how everything has come together.
Yeah, this is nice. I really enjoy the book what Stephen Lin wrote about dental diet. And I would like to ask you from early age, how changes in our diet and what we feed our babies negatively impact health. And that being said, if you can delve deeper into that and explain specific effect of a poor diet on breathing and overall well-being. I had several programs related to nutrition, and I want to know your opinion.
All right. Well, the first thing to understand is that breastfeeding is not about milk. Milk is part of it. The nourishment that comes from breast milk is part of it. A more important part is the mechanics involved in the baby being able to extract that milk from the mother. This is the muscle patterning, this is the swallowing patterning, this is the tongue positioning patterning, this is the nasal breathing of the child, because you cannot mouth breathe while you're breastfeeding at the same time. It makes a bit of a mess. So everything is combined here. Well, look, baby can't breastfeed, or mother doesn't want to breastfeed. Give the breast milk in a bottle. No, it's not the same, because the baby doesn't have to work the muscles and train the muscle patterns when sucking from a gravity-fed bottle than it does from having to form the vacuum at the palate with the tongue to express the milk down the back of the throat. So that is the first thing. That is the first misconception, that breastfeeding is all about mother's milk. It's much more than that. The second thing, of course, is that the body is designed to grow according to a natural growth pattern. And that pattern is fueled by its nutrition. And if you affect or if you change that nutrition, the body has to adapt. And sometimes it maladapts because it can't cope with the massive changes. So if you go back several hundred years before processed foods, before, oh, my baby had his apple today, I squirted it in his mouth from a tube. No, the baby would have been better off chewing the tube. Because babies don't chew anymore. Parents are terrified of choking. When did choking on food start to happen? 50 years ago? No, I grew up in Africa, and the African women strap the baby on their back with a shawl, and on the one hand they give it a stick of sugar cane, and on the other hand a stick of dried meat with tendon, and all the baby does all day is chew and chew and chew, and that is what develops the bone structure of the face and the jaws. That doesn't happen today. So if you're not promoting the growth of the jaws, don't be surprised that they are small. And if they are small, the mouth is smaller than it should be for the teeth.
We see it all the time.
It's not too many teeth for the mouth. It's too little mouth for the teeth. And what drives me crazy, Mary, is you go to a dental conference and you go to the exhibition hall and you look at a typodont. How many teeth in a typodont?
28.
Like that's normal. No, it is not normal. It is commonplace because the jaws are small. And that is a function of the type of food, the quality of food, and the masticatory things that are not happening that used to happen. I have 32 teeth. I go for a hygiene appointment. The hygienist looks at my mouth and says, "Oh my God, you have 32 teeth all in the right place." I said, "So what's surprising?" It's an evolutionary process. We have not adapted. Change has come far too quickly for the human genome to adapt. The human genome needs 45 to 50,000 years to adapt. How long have these changes been in our lives? Since World War II? 70 years? There's a mismatch. And we think that we are adapting. We are not. We are maladapting. We think we are living longer. We're not. We're dying longer. And that's an awful thing.
Yeah. I would like to ask you about asthma because every single day I see people with the sleep apnea, patients with the sleep apnea, and usually asthma is part of the medical history. And you mentioned what asthma diagnosis, 90% is not really asthma.
Exactly.
Could you please elaborate on that often misdiagnosed asthma and proper understanding of breathing, what can lead to better diagnosis and treatment?
All right. Well, first of all, the first fundamental law of medical measurement, of scientific measurement, is that the measuring process that you use should not change what you're trying to measure. And if people think about that, it makes a lot of sense. You can't measure something using something that's going to change what you want to measure. So the purpose of an asthma test is to determine the patency of the bronchioles. Well, those bronchioles will go into spasm the minute carbon dioxide levels in the lungs start to drop. Because the brain understands, and this is more biochemistry that we're going to go into now, the brain understands that if the carbon dioxide levels drop, the whole chemistry of the body changes. So the only way the brain can prevent further loss of carbon dioxide is to narrow the tubes. So the test for asthma is blow out all your carbon dioxide 3 times until you almost cannot breathe. Then they put a mask on your face with a chemical that opens the lungs and say, blow again. And you blow again and they say, you see, you've got asthma. And you say, no, you caused it. If you didn't make me empty my lungs, I wouldn't have become breathless. The concept is flawed. And if you specialize in a flawed concept, it just means you know more about that flaw than anybody else does. Specializing in something does not mean that if it is wrong, because you're a specialist, you make it right. So my contention has been for the last 30 years that the diagnostic process for asthma is flawed and is giving 90% plus positive results, which would not have happened had it not been tested that way.
Yeah, no, that's a great concept what you explain, and it's usually I see a lot of factors why people have asthma. You know, that mouth breathing, and it's usually come as a full bouquet what started in the early childhood. But I want to bring you to connect that concept of breathing through the mouth or very often breathing to the diet. And again, I want to mention Stephen Lin book Dental Diet. And could you highlight aspects of a dental health and breathing connection what discussed in the book?
Okay, let's go back to the first principle of fight or flight. When the body feels it is under attack or under threat, it responds. The brain does not have the ability to determine whether you're being chased by a tiger or an angry mother-in-law, or whether you've eaten food that doesn't agree with you and your body is saying, I'm in danger here. All the body knows is, I have to do something to counteract this threat. So if you eat foods which make your body feel uncomfortable, your body reacts and responds. So the prime things that happen with fight or flight are in nanoseconds. Your breathing pattern changes. Your skin goes pale because the blood rushes to the major muscles of fight or flight. Your endorphins rise in case you're injured. Hundreds of things are happening in those microseconds. The brain is not processing what the problem is. The brain is saying there is a problem. How do I save myself? So people who eat or drink things that threaten their body, their breathing pattern usually changes. And you hear people saying, oh, I can't catch my breath. I had a big meal. I can't sleep after I've had too much food. Life is very simple. We just make it very complicated. So the link between diet and breathing and asthma and snoring and sleep apnea and gastric disorders, that link is a common link. If the body is not functioning the way it was designed, it will go into protective mode, and protective mode will cause you to do things to survive at the moment, but not necessarily be good for you down the track.
Yeah, that's good. I um, come up with a name for our interview, like 5 strategies to have a healthy life. What would be the strategies what you would like to mention to people as a final, like a final words for the interview?
This is very difficult because we're faced with society. We're faced with expectations. We're faced with peer pressure. We're faced with having to survive financially, communally. There are expectations of us from our peer groups. So most people are doing the best they can, but that is causing them to compromise. So there is no such thing as a bad habit. No habit is ever created unless there is a payoff. Otherwise, the body wouldn't do it. The payoff is positive at that moment in that you can take the next breath. The payoff is negative if you're doing that 30,000 times a day just to survive, because then it's causing problems in the other systems in the body. So the answer to that is there is no answer. The answer is a personal one. How much are you as an individual prepared to change your life, your habits, what you do, the way you look at life, so that you're in harmony with your body? And not many people are prepared to do that because they feel that if they don't comply with peer requirements and the order of the day, that they're somehow out of link and out of kilter with the community. We're doing this to ourselves, and nobody is doing this to us. It's choice.
You're right. Thank you very much. We really appreciate your philosophical, like conceptual, view, and we're looking forward to learn from you. Thank you, Roger.
My pleasure as always, Maria.